Hello, my name is Erica Rotundo, lead nurse practitioner with the Palliative Care Service at Westchester Medical Center in Valhalla, New York. I will be discussing our research on trauma ICU patients, both with and without palliative care interventions. This research was presented at the American College of Surgeons Annual Clinical Congress Scientific Forum last fall. As the population ages, trauma patients are presenting with more comorbid conditions. Additionally, with advances in science and technology, these patients are surviving previously fatal injuries, leading to a greater need to define goals of care early in a hospital course. Palliative care is a service that assists with both injury or treatment-related symptom burden and discussions around a patient's goals of care. Like many specialty services endorsing inclusion of palliative care interventions, the American College of Surgeons recommends the parallel utilization of these services along with life-sustaining trauma care early in the hospital course. The aim of our research was to assess the impact specialist palliative care had on management and outcomes of patients admitted to a Level 1 trauma center intensive care unit. We performed a retrospective study comparing trauma ICU patients with palliative care interventions to those without palliative care interventions, looking for primary outcomes of length of stay and length of time on ventilator support. We found statistically significant decreases in the placement of tracheostomies and gastric tubes, ICU length of stay, and hospital length of stay when our specialist palliative care team was part of a patient's trauma care. The inclusion of palliative care interventions often leads to earlier goals of care discussion, with the primary goal of better aligning clinical interventions with a patient's goals and values. In doing so, there may be a reduction of unwanted interventions and a better defined plan of care earlier in a patient's hospital course. Thank you for taking the time to view this video, and thank you to the American College of Surgeons for showcasing this work.